morning, everyone. Thank you so much for joining us today to celebrate this year's BJC Diversity Week, the joy of connection. During this week, we hope that you are finding ways to spark the joy and curiosity in connecting with others while having opportunities for you and your colleagues to have meaningful, authentic interactions, serving as a reminder to everyone across the health system, we are better together. My name is Winston Wellington Wright, and I serve as Senior Consultant of Diversity, Equity, and Inclusion here at BJC. And this morning, I have the pleasure of moderating our panel entitled Caring for Those Who Care for Others, a conversation on the importance of belonging in healthcare and how our diversity as a system helps foster stronger connections between ourselves and those that we serve. So, panelists, thank you so much for being a part of this important conversation today. And to kick things off, just asking if you all would introduce yourselves by sharing your name, role, organization, and then a few sentences on your why. So what inspired you to pursue a career in healthcare? And I'll start with Sarah and then go to Terry, Matt, and Ty. But Sarah, it's on you.
Hello, I am Sarah Losi, one of the patient experience managers in the East region of BJC. I support 3 hospitals in their journey to enhance the patient experience. And within my portfolio, I also support pastoral care, a concierge program, and patient complaints and grievances at some of my HSOs. One of the things that I love most about healthcare is that I am surrounded by people with such a strong sense of purpose. The reason that I have dedicated my career to improving healthcare is because I am very blessed to have received extraordinary care when I was born 6 weeks early at only 4 pounds, 2.5 ounces, and not initially breathing. I owe my life to the skilled and courageous caregivers of BJC who provided extraordinary care to me. They saved my life and helped me heal and grow. For me, a hospital is one of the most special places where we don't just treat illnesses, we holistically care for every person in every moment, every time.
Thank you so much for the introduction, Sarah. Really appreciate that. Terry, how about you?
Hi, my name is Terry Madison. I am a charge nurse on 3500 at BJC Hospital at the observation unit. My why is my community. I grew up with my paternal grandfather, and he had a strong sense of community. My maternal family, we were just full of caregivers, nurturers, healers. Put that together, you have me, a person that love to care for the community. And so I've been doing it for the last 25 years.
Love it, love it. Matt, how about you?
Yeah, thanks for having me. My name is Matt. I work here in the West region, BJC, here at the St. Luke's, and I work at St. Luke's Hospital of Kansas City. I'm a nurse. I've been here for about 15 years. I have the honor and privilege of leading our stroke team here at the Plaza and system-wide, as well as the Western Division System Sleep Labs and inpatient epilepsy teams. And so I joke that I didn't choose healthcare or nursing. It totally chose me. I was in an athletic training program at a school and they lost their accreditation. And so I was like, I need to find an accredited program. And so I fell into nursing and I thought, well, I can do all the exciting things like ED and trauma and surgery. And I did those things in my young career. And now I'm kind of more in management. And so it's given me flexibility. It's given me excitement. It's given me the stability. So healthcare shows me.
Love that. Thank you so much, Matt. Ty.
Hi, I am Ty Solomon. I work for BJC West, and I'm the nurse manager of the Med-Surg unit. And my why is, I feel like we all were put here to serve others. And so that is what we do in healthcare. We serve others. And as a nurse manager, I'm able to serve the team who serve the patients. And it's no greater joy than to see people happy and sharing with me how it seems like the staff are in competition of who's trying to be the nicest to them. And they feel that genuine joy and caring spirit. And that's what fills my cup. There's been no greater joy than me seeing patients get better, go home, or even the ones who transition and their family feel like we really cared for them. And that comes first with caring for the staff. And they know how much I care. I look for the people who have the most compassion because we can't teach that. They have to come with that. And so my why is that healthcare and service to others gives me joy. And I think I chose healthcare when I saw my mother suffering through diabetes and wanted to ensure that people that I know got the right care and got better and felt better.
Wow, thank you so much, Ty. And thank you all for sharing. Heard purpose, community, right? Healthcare chose you. You didn't choose healthcare. Lots of great things there. And I also just want to recognize everyone is so young, but a lot of tenure here. So we got some experience. So this is awesome. And Ty, you kind of shared some things that, segue and set us up beautifully. Our conversation today really serves as a space to explore this idea of healthy and strong connections between our team members and the patients we serve, right? Because Ty, to your point, we know that together we make up a community, but a very diverse community as well. Question is coming to Terry, Ty, and then Matt. And happy to repeat it as well because it is kind of a two-parter if you need it. How do you support your team members regarding experiencing a positive environment, culture, and belonging at work? And then what does support for yourself look like as well? So Terry, we'll start with you.
Okay. So I'd like to answer that last question first because I feel like it's key for me. For the last 15 years, I've been in the hospital for 25 years, 16 years been a nurse, the last year and a half been charge nurse. With that being said, the statistics are right now, 68% of nurses are caring for their patients more than they're caring for themselves. I was included in that 68%. The pandemic has shed light on me. The interesting thing about that was I was a nurse that the organization had highlighted a lot throughout my career. I've got Daisy Awards, Community Service Awards, and such. And I was very honored by that. But what the pandemic has shown me was that I was given a greater responsibility for caring for my patients than I had gave myself the responsibility to care for me. And so I had to start making some very quick changes soon when I got that revelation. With that being said, a year later, that's when I stepped more towards the leadership role. And I knew for me that it was important for me to be a better accountability partner to the team that I serve so that they will be able to, because you have the resources there. The organizations have a bunch of resources and all of those things there to help you along the way. My experience was I want to be a louder voices for the team that I serve and to making sure that they're using those resources by becoming a better accountability partner to them. Because you really can't, like it was days that you do leave and you are depleted and you are stressed, and because nursing is just one of those fields, right? And I want to be honest about this. And so for me, with that being said, I came in and say, how can I lead a team where I am actually making sure that they are caring for themselves so that we can have the numbers, not just for the numbers that we need, but so that when we retire or when we get out of the field, we're not just in a worse position as our patient because we lack to give that to ourselves and the team that we care for.
Thank you for that. I really enjoyed something that you shared, taking responsibility for caring for yourself. Everyone kind of shared in their origin story or their why, we're passionate, we have the compassion, we see the joy in taking care of folks, but who's responsible for taking care of all of ourselves? So I love that. Ty, I'll come to you with the same question. How do you support your team members regarding experiencing a positive environment, culture, and belonging at work? And what has that support looked like for yourself?
So the way I have supported the team is that I have an open door, first of all. They know they can come in here and talk about whatever is going on, and I can direct them to wherever their needs may be. People come with baggage. You know, they don't leave things at home all the time. And so if they happen to bring it here to work, or I know this by being in tune with how they're acting and their body language, then they know this is a welcome space. And we have to take care of their mind, body, and spirit and get them to where they need to be so that they can take good care of the patients. And we have to make sure that we treat, it does not matter what their role is, EVS, food nutrition, nursing assistants, RNs, physicians, everyone matters. Everyone has a very important place in this organization. EVS and nursing assistants, they are patient safety, patient infection ambassadors. And we have to let them know that. And we have to recognize and acknowledge them. We've held celebrations for EVS, for nursing assistants. It doesn't matter. And just not because of a day or a week, we just do it. We pick a day and just celebrate them and tell them thank you. And so making sure they know they're welcome, they're important, their role, and it doesn't matter what their title is, everyone has an important space here. We also have this huge DEI banner that we have that I'm very proud of. It's pretty new. And so when they walk past the cafeteria, they see that we do honor DEI. And so that's another way to support the team.
Thank you so much. And definitely, we know that recognition goes a long way and there could never be enough. So we'll finish this question, Matt, with you. What are some of the best practices or things that you've been able to do to support and create this positive environment and also supporting and taking care of yourself?
Yeah, hey, thanks for letting me follow those two amazing ladies. So I appreciate that. No, all seriousness. So one of the things that we initiated in 2023 and continued in 2024 in our departments that I oversee is the Humankind Initiative. And yes, we're all humankind. I think you may see where I'm going with this. Humankind equals kind human. It literally has the word kind right in it. And so it's how we treat each other. No matter where we come from, no matter what we bring into work, just like Ty said, or what work brought to us that day, kind of like what Terry said, like our days are hard. Our main goal, it's actually a goal. Like, how is kindness a goal? But it is a goal. It's maybe not the most measurable. It may not be a SMART goal, but it's still our number one goal in our departments is humankind and kindness. And so we talk about it all the time. We talk about it at staff meetings. We talk about it in performance reviews. Anytime I get feedback that goes into our permanent record, we use Workday in the West region, and that stays with them when they get a compliment, whether I get it from a phone call, an email. We do surveys in a lot of our departments. If I see something on a survey, I'll snip it out and I'll send it to them. We'll talk about it during our staff meetings. We'll go through all the kudos they got, that month. So it's just front and center that we are all humankind and we all have to be kind to each other. And that's how we can promote belonging, and not just to our patients, but we work in hospitals. Most of us are clinics. And think about all the stuff that these people are bringing in. How many times have you seen people in the hallway hugging each other or outside the chapel? There's a lot going on, and there's so many opportunities to just be on the lookout for other people. And so that's one of the things we did. Another one is we talk about change a lot. So you're like, well, how does change, how does that fit into DEI? Well, if you haven't noticed, the entire landscape has changed in the last 5 years, right? We have amazing topics like this, with amazing weeks like this. And I think we have to embrace change. We have to embrace change in every aspect of our life. And so I talk about it with our team. We have a lot of people on our team that have been at St. Luke's Hospital, where I work, longer than I've been alive. So how do you manage someone who's been longer than you've been alive? That tells you the longevity and how much they enjoy the work they do. But also, when you change things for someone who's been here through all the history, you really have to get buy-in to them. You really have to tell them the why, and then they have to be a part of the change. So when we talk about changing a process or getting new equipment or changing a schedule, I'm going to bring them into that meeting, and I'm going to bring them into the decision so that they can be a part of the change, so that they can own the change. And so those are just some of the things that we've done. And then whatever the change might be, they can be a part, not only part of the decision, but a part of the implementation. In any aspect that if it affects their work, they have the opportunity to be a part of it and not just be told what's being done. And so I think those are some of the things we've done to try to help bring a positive culture in the departments that I oversee. And so what do I need? Honestly, I have one of the best bosses ever. You know, they always say you don't always sometimes leave a job, you leave a boss. I have an amazing boss. What she does for me, she gives me a work-life balance. I know Terry talked about this too, so I won't hit it too hard, but works hard. And, you know, one of the things I talk about too is when you're at work, give me all of you at work. And when you're off work, that's your time. That's you. That's your time. You know, take care of yourself at home. Family is always first. And so I will support everything you need to do to take care of your family. But when you're here and you're all in. And so that's what my leader does for me. And that's what I try to do for the people that I oversee. And then I don't like to be micromanaged. You don't have to look over my shoulder. Trust me to do what you ask me to do. So thanks.
Wow. So, you know, that's kind of a mic drop. I typed down quite a few notes there, but one of the things, Matt, that you shared, and you kind of answered my follow-up question already as well, is owning the change. I think that's very, very powerful, particularly in healthcare. Change management, fast-paced environment. Seems like we're getting new processes a part of our standard work every other day. And really being able to bring in folks from different generations, different tenures, and making them feel like they're a part of that process. Definitely think that is really powerful. So this next question, it actually is for Terry and Matt, and it's just a follow-up. Can you think of a time when you have had to broaden your perspective as a leader to better help support your team? So Terry, I'll come to you first, and then Matt.
Yes, sure. I think when I first became starting to get into the leadership role, I had a very narrow, I would say, view because I was the bedside nurse that only like was at my patient bedside. That's what I was doing. And so when I got into leadership now, and I always went in with the mind frame that I am here to serve my patients. And when I stepped into leadership, I had to broaden that to have an understanding that now I am not only serving my patients, I am here to serve the nurses. And I had to really connect with myself and have a lot of self-awareness to be able to lead them with a lot of grace. And with that being said, I feel I had a conversation with my manager. I think it was key in this. And she said, Terry, I sent you nurse, and I feel like it's a gift. She said, now you have a place where I need you to lead others. I need you to not only model excellence, I need you to lead others so that they may model excellence as well. And I was not the person that was seeking to be in leadership. So I had a lot of growing that I had to do, but I understood that if I would just connect with myself and the more patience that I had with myself for growth, the more patience I was able to give my team, the more I don't know. It was just something that I had to gracefully walk. I had to gracefully walk into, and just being an example and being open and being honest with them, and then giving them the freedom to speak back. So I'll give you an example. It was this one time where I had to correct someone. With that being said, I was like, I don't really know if I handled that the right way. And so I asked the staff, I pulled them to the side. I'm like, you have every right to tell me, how do you feel about the way I handled that? And so we had open dialogue about it. And it was just that moment in my leadership path that I feel like they was like, oh yeah, we can trust her, we can rock with her, because I was able to say, yeah, that didn't look right. I didn't work there well, but come on, we're gonna do this together. We're gonna get to where we going. And so that's just something that I just took with me, that I have to serve the nurses in the way that I have dedicated to serving the patients, and I have to give them grace, and I have to keep meeting, and I have to keep cheering them on to meet the mark, knowing that we can do it. So yeah, it just took for me to get outside of me and the patients to go to me and the nurses, and then just kind of like having those conversations, picking back off that last question, like just making sure that I'm asking them like, hey, are you goal setting for the 8 areas of wellness? And they're like, we ain't never heard of that before. Well, let's look it up so we can talk about it and we can go set forward. And so I just always, those little things for me has helped me along the way. And so, yeah, I'm honored to be in a position where I can work with the staff the way that I do. And I'm honored that they give me the room to grow in it. So that our patients, I feel like as I connect with them, they connect with the patients. And so, yeah, that's my answer for that.
I love that. Thank you. No, so much is excellent. Self-awareness, leading to be able to give grace to your team members. So thank you for sharing. Matt, how about you?
So, so for this one, I'll give another example. So my leadership journey started out where I was over programs only, specifically disease-specific programs such as the stroke and STEMI program, later just the stroke program. And that was pretty familiar because I had worked bedside and I knew what the bedside nurse does in order to help them with their program. Well, then my role expanded again, and I took on leadership over departments and about 40 employees in sleep disorders and neuroepilepsy who are technicians and schedulers for the most part. I have never hooked anybody up for a sleep study or an EEG in my life, and I still have not to this day, 3 years later. So there's a challenge. There's a role expansion. And so the way I attacked that was I didn't pretend I knew the answers. I didn't pretend I could do their job or I knew what they were going through on a daily basis. I asked a ton of questions. I gave them the freedom to give me dialogue about what's going well, what needs to be better, what needs to be improved. I certainly didn't, I'm going to say that term again, I didn't micromanage them because I couldn't micromanage them at the time, even if I wanted to. But what I learned is, people just want you to be genuine. Like they just want you to listen to them. Just listen to me. Tell me what you're concerned about. Take notes and then follow up on it. So many times people go to a coworker, a leader, and they'll have a complaint or a suggestion, and then it just kind of nothing happens. And even if the answer is no, I try to always get back to my employees when they ask me to do something, and I try to get back to them in a timely manner. And I think even though they know I can't do their job, they know that I can support them because I'm going to listen and I'm going to follow up. And really, I think when we're trying to promote belonging and we're trying to promote kindness and we're trying to ultimately enable everybody to do the same goal, right? Take care of the patients. That's really what it comes down to. You can empower and help everybody if you just listen, communicate, and just do what you're going to say you do. And don't pretend you know what they're going through. I don't know what they're going through. I have to listen. It's the old saying, you got 2 ears and one mouth for a reason. And that's what's gotten me through the last 3 years, managing a team that I can't do their job and I've never walked in their shoes. So that's how I answer that question.
Hey, thank you. Thank you both. Just a lot is resonating with me, definitely when I just think about, some of the everyday challenges. I think that all of us as healthcare workers in all spaces at all leadership levels definitely go through. So I appreciate you all just being really concise, but also thorough with some of your responses. Now, I want to shift, and Matt, you've been doing a really good job actually at segueing us through the conversation. So I want to shift to how, this idea of increased belonging for our team members and employees can ultimately impact our patient experience, right? So I'll be coming to Sarah and Ty with this question. But the question is, what effect does employee experience and belonging have on the patient experience? And can you all tell us maybe a story or a situation that further explores and exemplifies this important intersection? And Sarah, we'll start with you.
Yes, Winston, thank you so much for providing the opportunity to talk about this. Earlier in our conversation, I love how Matt talked about kindness, embedding it in the culture, and even attempting to measure it. In my experience, a culture of kindness and belonging is an integral component in achieving experience excellence for everyone involved. And we have evidence of this, of the impact of this in the East region. So I'd like to share a story about the incredible team on 4 North at Progress West Hospital on the outskirts of St. Louis. At the end of 2022, this inpatient department had a patient experience net promoter score that was in the 10th percentile. And in the first quarter of 2023, their adjusted voluntary turnover rate for team members was 79%. So the nursing leadership team recognized the need to implement some significant changes to improve outcomes. So in partnership with an internal diversity, equity, and inclusion expert, the nursing leaders initiated a change management plan with the critical foundational element of creating a culture of belonging for all team members. This work was done with thoughtfulness and intentionality, occurred over the course of several months, and has become embedded in all aspects of their operations and culture. Tools and activities to enhance teamwork and strengthen relationships have been provided and shared. One key tactic that they have leveraged includes completing an activity to gain insight into their own identities and biases. They also routinely share personal stories at staff meetings and are intentional when assigning preceptors for new employees. One of the tactics that I love most is that they are frequently celebrating and they are finding ways to make it easy to create extraordinary moments for the patients, and everyone is empowered to engage and participate. So this work formally began in April of 2023, but has continued to evolve over the last 16 months. And I'm pleased to share that the 4 North team has reduced their adjusted voluntary turnover rate to 14% from that original 79. And additionally, the team has seen year-over-year improvements in patient experience scores regarding nurse communication, overall teamwork, and overall quality of care in our patient experience scores. At the end of 2022, their net promoter score was in the 10th percentile, but at the end of 2023, they had improved to the 70th percentile, and year to date, they are currently achieving the 97th percentile in net promoter score. So I'd like to end this story with a little bit of a quote because I think it ties it all together. Brene Brown is quoted as saying, "A deep sense of love and belonging is an irreducible need of all people. We are biologically, cognitively, physically, and spiritually wired to love, to be loved, and to belong." And I think that the core message within this story is that when we invest in belonging, not only do we feel good, but we also achieve very tangible results for our team members and our patients. Thank you.
Thank you so much, Sarah. That was absolutely incredible. And we love to obviously be able to recognize our team members that are committed and actively, working towards just fostering more belonging, both for our employees and our patients. So excellent example of best practice. Ty, how about you? This intersection of employee experience and patient experience and why it's so important.
Yes, thank you, Winston. And Sarah, I have to follow that. Okay. So I have a couple of examples. So one that sticks out in my mind is that we purposefully celebrate our staff. Med-Surg, my unit, was one of the first units to go more than a year with no patient infections, 0. And so we recognize that, hey, we need to do something. This comes from hard work, it comes from dedication, and it comes from leaders. And so we were the first unit to have a celebration for 0 patient infections. And so since that time, we have rolled that out, and we make sure our executive team are sure to recognize and acknowledge when we have 0 infections. That's huge. And so the other thing that I'm very proud of here on the Med-Surg unit is that if you were to come up to my unit, you will see all kinds of staff. It does not matter. When I'm going through the hiring process, I look for compassion, period. I can't say period. I should say and character and competency. So I look for the 3 C's. So when you do that, you open yourself up to all kinds of staff opportunities, leaders all across the board. So it does not matter the color, creed, race, none of that matters. You're looking for character, competency, compassion. And so the staff know that it does not matter. You know, certain things don't matter. We just, certain characteristics we look for in a healthcare, this healthcare facility. And so because of that, I think that transcends to how they care for our patients, because we could get patients who speak a different language, and we have the tools to be able to communicate with them appropriately. And we recently, well, January of this year, we rolled out a product for people of color, their hair, to care for their hair. It was recognized that we did not offer that. And so we have a product called Be Serene, and it's for people of color to care for them and for their hair. And so that has been huge. And since that time, the staff have come and say, wow, you really care. You care about everyone. So that's been phenomenal.
Thank you so much, Ty. And I think, I want to say I really love the three C's, the compassion, character, and competency. I think that's a really, really good nugget to share with the audience. And I just want to say all of you have definitely, again, been able to just speak so eloquently just about, this intersection of belonging, employee experience, and how that really first step of taking care of ourselves ultimately will roll over, trickle down, trickle up to our patients. So just want to say thank you all for sharing these insights and these stories. And as we wrap up our conversation, and this is for the entire group, so Sarah, we'll start with you, then go to Terry, Matt, and Ty. But what would be one call to action you'd have for any of our team members across both the West and East region that are listening today? So Sarah, we'll start with you. What's that one call to action?
Yes, thank you. I would like to ask that we all begin actively and intentionally building or advancing our culture of belonging today. This could look like reading an article, asking curious questions, listening intently, inviting someone into a conversation, or many other things. I really love how Terry talked about how she embraced the opportunity to learn and grow, and this growth mindset is so important. To truly deliver extraordinary care, it takes all of us as caregivers coming together to live the mission, vision, and values of BJC. So please lean in and begin actively working to build or advance this culture of belonging today. Thank you.
Love it, Sarah. Terry.
Okay, so I would say that nurse care should be given from the inside out, and that you are important. So please take care of yourself and look for opportunities in which you can hold others around you accountable to take care of themselves as well, because they are important too as we do our duty to the community.
Thank you so much, Terry. Matt?
All right, so my call to action would be that you control your legacy. You build your legacy. And I'm actually going to read here what the definition of a legacy is. A legacy is the impact of events or actions that took place in the past, which is formed in the present and will endure in the future. So I ask you, what is your legacy? Think about the people that you work with right now. If you had to describe them to someone who never met them, how would you describe them? You are describing their legacy. So every day you go to work, every day you interact with the people you care for, the people you work with, the people you see in the halls, is an opportunity to build your legacy. Nobody can define your legacy but you, and nobody can control your legacy but you, and you have an opportunity every day to build that legacy. So that's my call to action.
Love that, Matt. Thank you. And Ty.
My call to action would be to ensure that you are avoiding assumptions and approach every issue or situation with the spirit of curiosity, because what we think we know, oftentimes we're wrong. And so we should approach any kind of issue or situation with the spirit of curiosity. Get to know the issue, get to know the person, get to know their situation.
All right. Well, thank you so much again, panelists, for sharing some true gems with our audience. And of course, thank you, audience, for sharing some of your time with us today. So as we sign off from our panel this morning, please feel free to share feedback by using the links to our evaluation form and visit our Diversity Week SharePoint page for more information on how you continue to get involved in our celebration. But with that being said, we wish everyone a great rest of the week and happy Diversity Week.